A new measles outbreak is being reported in the Southwest. Officials say more than 100 people have been infected in Arizona and Utah since August. The cases have mainly been clustered in areas with low vaccination rates. Southwest Utah has seen more than 40 cases, and in Arizona, a county that had no measles cases reported in the last 2 years, has had 80 infections. This is all contributing to the 34-year high in U.S. measles cases. I want to bring in Dr. William Schaffner. He's a professor of preventative medicine and specializes in infectious diseases at Vanderbilt University Medical Center. Doctor, always great to talk to you, although this is really sort of a troubling story. Both outbreaks, as you know, happened along the Utah-Arizona border and in western Texas. They started in rural communities before they spread. What does that indicate to you?
Well, Vlad, it's a very sad story because we shouldn't have any of these measles cases. Measles is a very, very nasty virus. It's spreading among children who have been withheld from vaccination. This is the most contagious virus we know, and when it's introduced into a population, it will spread rapidly among children, among their schoolmates and playmates. It really will make you quite sick for a week or a week and a half with fever, red eyes that are sensitive to light. Children often are kept in a dark room, so their eyes are not affected. They have a runny nose, they have a cough, they feel miserable, they don't like to eat, they can become dehydrated and have diarrhea. And then the complications set in. Middle ear infection, pneumonia, which is more serious and most serious, fortunately not too common, but still very serious, encephalitis, that is swelling of the brain. 1 in 8 of these children are being hospitalized. Who wants to have their children hospitalized? This is a completely preventable infection.
So, I mean, if a parent is watching this and you want to take precautions, what do they need to know about how to protect their children from the measles? And if a child is vaccinated, doctor, and is in contact with the child who's unvaccinated or who even has contracted measles, is that child, the vaccinated child, protected?
Well, the vaccine, if you get the 2 recommended doses, is about 97 to 98% effective in completely preventing the disease. There are a few so-called breakthrough infections, but even then, they're much milder. And of course, I always say, don't listen to Dr. Bill. Talk to your own healthcare provider, your doctor, your family doctor, your pediatrician, the physician's assistant or advanced practice nurse who takes care of your family. Have a conversation with them about this. It's so important to prevent this disease. We're having smaller outbreaks in many other states now, and our status of measles elimination is now under threat.
And finally, what about adults? I mean, if a child, if an adult contracts the measles, I mean, I know oftentimes certain infectious diseases that are relatively mild for children can have a really significant impact on adults. What's the case here?
Well, I've already told you measles is not mild in children. It's a nasty infection, and it gets nastier for adults. Adults are much more likely to have the complications, particularly of pneumonia. And that's one that'll take you right into the intensive care unit.
Wow. I mean, we just had our daughter vaccinated, and I used to work in Africa when I was a foreign correspondent, and I would meet people who had, for example, in the time that I was living in Lagos, Nigeria was still one of only 3 countries in the world that still had polio. And the people there would just say to me how lucky I was to have been born in the United States, where we had a government that ensured that its citizens were properly vaccinated. And now Nigeria has eradicated polio, but I'll never forget walking into some villages and seeing children that had been deformed by this horrible disease, and just them saying to me that how lucky I was to be the chance that I was born in the U.S. Yeah, it's really terrible. Doctor, thank you for your insight, sir. Appreciate you.
I appreciate it. Thank you.